Good morning, everyone. You are here at our third episode in our lecture series about voter engagement and social work ethics. I'm Silas Ortiz. I use they, he pronouns. Uh, and I'm here with Vanessa and Christina from Vote-ER. Vote-ER is a nonpartisan nonprofit organization working to integrate civic engagement into healthcare. And we have two great social workers and a social work student here to present. So I'm going to hand it off to you, to Vanessa and Christina.
Hi, everyone. We are so excited to be here with you guys today to present on civic engagement and social work as an intervention. Before we get started, though, I did want to kind of see where you guys are at. Just go ahead and drop into the chat your name, city, school, institution, and what is one thing you hope to take away from this presentation. Oh, we got some North Carolina people, Delaware, Michigan, of course, Detroit, Charlotte. Awesome. All right, super cool to have all of you guys here. Just as a little bit of introduction, oops, went a little too fast, but as a little introduction of myself, my name is Vanessa Navarro and I go by she, her pronouns. I am a Vote-ER intern and I'm also an MSW student at Boston University. Um, this is my favorite stuff to talk about. I love talking about voting and I love talking about how voting and social work should be interweaved together. So I've always had a passion in politics, but it wasn't until I took a policy class with my co-host, Christina Kazanov, or as I knew her, Professor Kazanov, that I realized that there is such a need for social workers in these spaces. But for now, I will pass it to Christina to do their introduction.
Hello, everyone, and good morning. Thank you for joining us. My name is Christina Kazanov. I am a professor for undergraduate social work and a director of internship at St. Leo University, which is about 20 minutes north of Tampa, Florida. So yes, I'm in Florida. uh, I am I am just uber excited to be with all of you today and get to talk about my favorite topic, which is voting. I love to talk about this. I love to engage with other social work professionals and students in talking about how we could collectively use our voices to try to change not just our federal, but our state and local decision makers' minds in doing what's best for all of us. And then I'm also the legislative committee chair for the NASW Florida chapter. So I get to talk about this on a more regular basis within my state. And I'm just psyched to be able to co-present with my fellow student, now professional social worker as well today with all of you.
Yeah, so both Christina and I have roots at the NASW Florida, so we just love to talk to different chapters too. So this is very exciting for us. So there we go. So just to get into what we're talking about, the reality is that 80% of health outcomes are determined by non-medical factors. So we're talking about access to food, transportation, and affordable housing. So those all affect our well-being. And Vote-ER's origin story offers a powerful illustration of this truth. Vote-ER was started in 2019 by Dr. Alistair Martin, an emergency room physician at Massachusetts General Hospital. One cold Boston winter evening, a woman came into the emergency room with her two young children. She explained to Dr. Martin that she had just recently moved to the state with a partner who she was now attempting to get away from due to experiencing intimate partner violence in the relationship. She had been sleeping with her two children in her car because she wasn't sure where else to go, and she told Dr. Martin that she looked in the back seat, and saw her youngest child shivering and knew that she couldn't stay one more night in her vehicle, so she came to the hospital. She told Dr. Martin that they were cold, hungry, and needed help. When faced with this dilemma, Dr. Martin called, obviously, the on-duty social worker, and the social worker explained that Massachusetts is a right to shelter state. This means if you are an eligible Massachusetts resident and you have children, you cannot by law be left out in the cold. Whether there's room in a shelter or the government has to pay for a hotel room, they'll make sure that you sleep under a roof. There's only one other place quite like this, and that is New York. But because this mom had just recently been brought to Massachusetts, she was unable to provide the needed documentation. When Dr. Martin explained that to the social worker, they said, no problem, we can register her to vote in order to establish residency if that's something she's open to. So Dr. Martin went back to the mom and asked her if she would be interested in registering to vote. And the woman said, no one has ever asked me that before. I didn't know that that was something that I could do. And that was a light bulb moment for Dr. Martin and the inspiration behind Vot-ER. So what that patient was experiencing with Dr. Martin was a health-related social need, and what causes those are the social determinants of health, which are the underlying community-wide social, economic, and physical conditions. But we can't begin to address the social determinants of health until and unless we begin to address the structural determinants of health, the causes of the causes. So why is it so difficult for people to get a job in certain communities? Why is it getting harder to pay rent and get access to quality food? When you zoom back out by these social determinants that are caused by a myriad of factors, which are social, political, environmental, and various others. Some of you might have heard this before, but a good way of looking at it is to think about it as a stream of water. So the upstream, which is the structural determinants, are the policies that our elected leaders put into place. These can lead to health inequities that are often referred to as, quote unquote, the root causes of a lot of health issues. Medicaid expansion is one example of a policy that might be passed by elected officials in our state government. And social determinants are the results or the downstream effects of the structural political determinants at the top of the mountain. These are conditions and environments that people live and grow up in. Going back to our example of Medicaid expansion, we can think about the access to affordable health insurance coverage that may or may not be available depending on your state's expansion or non-expansion of Medicaid eligibility standards. Ultimately, the downstream effect of the structural determinants are the health outcomes of our clients. Chronic pain as a result of untreated illness from lack of insurance coverage and affordable health care options, for example. So in order to prevent the negative downstream health outcomes, we need to make sure that the voices of the communities that we serve are being heard in the democratic process. So we have a problem, it might be the biggest problem that we have, is that too many people are not voting. There are 72 million unregistered voters in the United States, which is the entire population of France. So why are there such large numbers of people eligible to vote but that are not registered? One answer is that they have never been asked. 62% of unregistered eligible voters have never been asked to register to vote. I would love to see in the chat how you guys have been asked to register to vote. We can see by this chart, 62% have never been asked, 16% by a government agency, 14% by a friend or family, 6% a civic group, 5%, etc. I was asked by the DMV. Yeah. Community events, DMV, family. Yeah. DMV, yeah. High school. So a lot of government agency and friend and family. Yeah. Alrighty.
So when we think about how we got asked, one of the things that we have to remember is not everyone has these opportunities. If we look at the disproportionate of some of our clients, many of them do not even have a state ID or a driver's license. So going to a DMV and being asked there is not a reality for them. We also know that many of our clients come to this country after high school, so they're not being asked there. And many of them are also not able to participate in the election as a child because their parents were unable to. So there are many opportunities where they are not being asked, are they registered to vote or are they able to participate in civic engagement activities? So when we look at those that fall into this category, those are those that are young, low income, and people of color. And unfortunately, over the last couple of years, we have seen both at state and federal laws trying to be put in place or have been put in place to disenfranchise these same populations from registering to vote and actually heading to the polls. So it is our job collectively, not just as representatives of the social work profession, but just as Americans, to be able to ask individuals that we come in contact, are you registered to vote? Because when our clients don't vote, they are less likely to feel the impacts that are necessary for them to thrive in a healthy democracy. Here's what we do know. Campaigns spend so much attention and spend so much money on finding out who actually votes. There's a lot of data that's being put in there that they are paying for to get to see how many people are voting, where are they voting, what elections are they voting. There's even categories of individuals and labels for those that always vote, to those that sporadically vote, to those that don't. So if they're paying so much attention to us, we need to make sure that we're paying attention to what's happening. Because when people do not vote, their voices are not being heard. And those elected officials are either ignoring what's happening in their community or feel as if their community does not need the attention that is given. So they are less likely to have their issues being brought into committee hearings. They are less likely to have their issues to be talked about when we explicitly look at health concerns, housing concerns, and other areas. But what we do know, next slide, please, that those that are participating have the ear and the eyes of their elected officials much more. It is because they are hearing from their community, or it could be because, again, they work for us and they're trying to do what's best for us. When people vote, we are able to see the outcomes of it. We're able to feel the impact. We are able to see funding come back into our communities. We're able to see boards be more attention. We're able to see how elected officials are making decisions and the rationale for their decisions come back to what's happening in their communities. But it's our jobs to ensure that our communities are well equipped to be able to have their voices heard. And it starts with the voting box. So why do we do this? Because civic health is part of the social work profession.
Yeah. So we're going to now go into how does civic and health and social work connect? There are so many tools that we can use to support our clients in achieving the best outcomes possible, and voting is one of those. It's just one tool, but it is such a powerful tool. Let's take a look at some of the research that shows that our communities are healthier when voters have access to the self-determination, autonomy, and connectedness that come from participating in the democratic process. So in June 2022, the American Medical Association formally recognized voting as a social determinant of health. Vot-ER med students worked collaboratively with the National Medical Association and the Minority Affairs section of the AMA on the recent resolution. And we have been hearing from individual providers, professional organization, and healthcare institutions that this has been a complete game changer and gives credibility to the work that we're doing.
So as social workers, we all went through the training. We hear it very often that we are either a micro-based, meso-based, or macro-based professional. And for many years, we all have stayed in those categories. Many of us can say, I'm a macro social worker or I'm a micro social worker. And then there's that small amount that we don't pay enough attention to, our meso social workers. But the reality of this is not a micro, meso, macro professional category for voter registration. It's in a collective, because we see the impact of voter registration at the micro, meso, and macro level. And these are just some examples that you see on the screen. The reality of it is, as social workers, no matter what level of practice is, social workers can mobilize, and we can do it fast because of the work that we're engaged in. Being able to ask an individual if they're registered to vote is a micro intervention. Being able to do registration drives is a macro intervention. Being able to do research to talk about the long-term effects of voting registration, like Vot-ER has done, is a macro intervention that can lead to meso and micro. All of this is collectively together is a social work professional component, no matter what level of practice we're in.
And perhaps most importantly, what we have been seeing can be viewed in this graph is that when voters are touched by their nonprofits, they had the largest turnout advantage when compared to voters in the general electorate. When a nonprofit reaches out to Asian, Black, and Latino clients, they had dramatic improvements of voter turnout and the largest voter turnout advantage. And we confirmed this at Vot-ER with our own work. We've learned since we got started in 2019 that healthcare-based voter access results in higher turnout by almost 20% compared to traditional get out the vote organizations.
What we also know that is this type of work is founded in our code of ethics. It has been part of who we are. It's part of our training and our education. It's one of the reasons why you all are attending a workshop like this as continuing education. It is who we are as a practice. Our code of ethics calls us to serve the greater community and the greater good. Our values tell us to ensure that each person has the ability for self-actualization and empowerment. And voter registration and voting does that. We tackle social injustices. It's part of our ethical principles and our values. And voting allows us to do that. When people think of voter registration, many people think just the general election. But what we're doing in that voting box is voting for judges that will carry out our criminal justice system and make the policies and procedures for our own. We're voting for school board members in hopes that they create fair and equitable decisions for our children and our teachers. We're voting for amendments that are going to impact the lives of those in those different states. So we have a responsibility, not just as social workers, but because it's embedded in who we are as our profession, but it's embedded in who we are because we entrust and try to build equitable services for everyone and uphold the dignity and worth of individuals.
All right, we have a little video that shows social workers using the Vot-ER tools. I actually love this video so much, so I hope you guys enjoy it too.
Vot-ER was inspired by an experience that I had with a social work colleague taking care of a patient right here in this emergency department. And social work really is at the core of what makes Vot-ER so special.
Voting is social work. Integrates voter registration and civic participation into social work, education, and practice nationwide. work with schools, professional organizations, and agencies around the country.
Social workers have always understood the importance of voting to political action, community power, and social change. Since its founding in 1955, the National Association of Social Workers has promoted open access to the ballot box.
The Healthy Democracy Toolkit is an important additional clinical tool that I use that both helps me build on the legacy of voting rights in the social work profession, but also helps my clients have a say in the policies that affect their day-to-day lives.
After every biopsychosocial assessment, I like to ask my client if they've registered to vote and then assess different barriers that maybe my client has experienced either in the past or currently in terms of registering to vote or getting out to vote in a safe and healthy manner.
Empowering clients to vote by integrating voter registration into my clinical practice has been transformational. Registering our clients to vote and explaining the way their vote matters, especially in local elections, is a way we can empower our clients to be heard.
Voting is good for you and for our society. People who vote report more employment, better health and mental health, stronger social connections, and most important, a greater say in the decisions that affect their lives. Without the vote, there can be no social justice and no democracy.
Elections happen every year. Voter engagement and education is part of our social work code of ethics. But where do we begin? You can start by helping your clients get ready to vote.
All right. Oops. Oh, there we go. All righty. So this is a question that we get a lot. Is this legal? Can we do this as like if we work in a hospital setting or as one-on-one with our clients? And the answer is yes. The National Voter Registration Act of 1993 allows hospitals and social service agencies to facilitate nonpartisan voter registration for interested patients. The same law also designated DMVs and all state agencies that provide public assistance as voter registration agencies. Because clients voluntarily enter their information using their own devices, these activities are not subject to HIPAA regulations. We're all familiar with the way the DMVs are equipped to register voters. So why can't we do the same? Voter registration belongs in these spaces just as much as in the DMV. Americans often have more regular interactions with the healthcare providers, social workers, and community health workers in their area as opposed to going to the DMV. So bringing voter registration into these spaces would be an important touch point. Vot-ER's platform ensures that badge users remain nonpartisan. That is very important. We must remain nonpartisan while we have these discussions, and also gives confidence to when helping clients register to vote. So when we go back and think about our DMV discussion, I really think the point that really drives home for me is that we see healthcare professionals, social workers, and community health workers way more than we see people at the DMV. I can't tell you the last time I went to the DMV. I think it was like 10, 15 years ago. But I went to the doctor just recently. So having more places and more visibility with voter registration is always a good and important thing. Nonprofit Vote has released a set of legal guidelines to help nonprofit organizations understand that what they can and cannot do in regards to voting issues. 501c3 organizations may conduct nonpartisan voter engagement activities designed to help the public participate in elections, such as voter registration, voter education, and get out the vote work. This means that social workers, clinicians, and healthcare organizations can, one, point clients and patients in the direction of posters, handouts, or introduce them to scan their Vote-ER registration badge and let the software guide them through the process. So I actually have my Vote-ER badge right here. It's very nice, very handy, and yeah, so it's easy to point somebody to this, and then they'll do everything on their own, scan the QR code, and be able to do it that way. Number two, say that we are offering service to clients to register to vote, but we do not endorse a political party. Again, stressing that nonpartisan aspect is super important because it's a way to gain trust. We don't want anybody to feel like we're pushing a narrative onto them or pushing some sort of agenda, because really we just want them to vote. We don't need to know who they're going to vote for. We don't need to know those specific reasons. We really just want them to vote. So just make sure that we do not endorse any political party. And then also help a patient complete the registration form while remaining neutral. Again, goes back to that nonpartisan aspect. And the 1993 National Voter Registration Act encourages this type of nonpartisan voter registration. I'm gonna ask Christina if she's had any experience with this or has had any conversations with people regarding like fears about registering people to vote, or like how to remain nonpartisan.
Sure. So in the state of Florida, we have a high mixed status group of clientele in our state for immigration purposes. We also have a lot of individuals that, due to the politics of our state, are nervous to ask this question. But as Vanessa stated, it is legal. It's legal for us to be able to do this as long as we're saying, are you registered to vote? How can I help you get voter ready, instead of asking them to support a political party or a candidate. Here's one of the great reasons why I love Vote-ER and why I recommend clinical social workers and students and anyone to be able to use it, because it is teaching the empowerment of them doing the work. When they scan that QR code, it brings them to a series of questions in which they fill in their information, and it connects them to their supervisory of election. So if an individual is not allowed to do online registration in their state, it's going to stop them right there. If they are unable to register, it's going to tell them to contact their supervisory of election. If they are registered to vote, it's going to let them know right then and there, so they're not duplicating the efforts. But the biggest thing is just asking them that question, asking them, are you registered to vote? Asking them, have you checked your voter registration status? It's really simple because of the system that's put in place. And there's many ways that you can do this. Having that badge with the lanyard that says, are you ready to vote? I wear it around myself when I'm on campuses, and I've had students and faculty and staff just stop me and say, what is that about? And it opens up the conversation. I've seen many clinical social workers, and I put this in the chat, add it to their intake paperwork, where it's a simple question saying, are you registered to vote? Yes or no? And if they say no, then a follow-up question on the intake, would you like information on how to register to vote? So that you don't actually have to do the ask, you leave it in the hands of them to be able to do that. I've seen my clinical social workers that do telehealth, they have it on their background screen, the QR code that's there that says, are you registered to vote? So their clients can go ahead and do that. Or if you have the courage, being able to ask them in unique times. I saw Bernadette saying, there are times where we wouldn't ask, and of course you want to be sensitive to the situation that is hand. But if the door is open, here's your courage to be able to do that. And what's great about Vote-ER is they give you a script. They give you a script for those that may not be able to be eligible to register to vote, a script for those that are immigrant or undocumented, those that you're just asking your client to register. So following that script will give you the courage enough to be able to ask. And here's the thing, the worst thing that they can say is no, but at least you asked, because most people are never given the opportunity to ask if they're in that group of disenfranchised. And here's the other thing. There are so much laws on voter suppression in which people who are well knowledge are being removed from the polls or being removed from the rolls. I'm a perfect example of that. I check my voter registration every single year. It's just something that got ingrained in me as a child. But when I went to check this past September for National Voter Registration Day, I was off the roll. I was off the roll because it just, something happened within my state and they purged the rolls and they removed me. If I wasn't asking individuals, are you registered to vote? They would never know if they were still on the roll or not. So no matter who you are, or if you're actively involved or not actively involved, we should still be asking each other, because we may need to update, because we need to check, and it should be part of our habits, just like it's part of our habits and our health to go to the doctor and get our yearly checks.
Yes, thank you. And Christina mentioned the badge and then also conversation starters. So we're going to go into how Vot-ER came up with ways to help. So the broad reach of our healthcare system, combined with our trusted roles and the trusted roles of doctors, nurses, and social workers that we hold in our communities, make healthcare an ideal arena for civic engagement to engage voters. This unique position allows professionals to not only address the physical and mental well-being of individuals, but also to foster a more informed and engaged community. By integrating voter education and registration initiatives into routine healthcare interactions, medical institutions can help bridge the gap between public health and civic engagement, civic participation. This setting also provides a nonpartisan platform where individuals from diverse backgrounds can receive unbiased information about the electoral process. And one thing I want to highlight here is where it says into routine healthcare interactions. And like Christina said, like, obviously, if there's like emergencies or anything like that, we aren't asking you to ask people to register to vote, but to start utilizing it like during discharge, or if you're doing a biopsychosocial, or just getting some history from the client, then it could be a good way to get into the habit of asking, as it has been shown that this is a social determinant of health, people's ability or access to voting. And yes, Vot-ER is a great way for social workers to demonstrate their commitment to voting rights, health equity, as it provides a straightforward and nonpartisan method for registering patients to vote. The program is completely optional. It won't interrupt your workflow. And additionally, Vot-ER is a politically neutral organization, meaning that it doesn't promote any particular political agenda or candidate. It is a great way to empower clients and help tackle the health disparities we witness in many spaces across Americans' healthcare. Across Americans' healthcare. So Vot-ER has made it super easy for professionals at all levels of healthcare systems to incorporate civic engagement into their practice by providing compliant, safe, and nonpartisan tools like individual badge backers, digital posters, and patient handouts, and then as well as conversation starters on our website to support professionals with the process of inviting their clients and community members to check their voter registration or vote by mail without interrupting the flow of service. Clients are able to scan a QR code or visit a link in order to be directed to a user-friendly portal that walks them through the voter registration process, saving the service providers time and energy while allowing them to encourage voter engagement with their clients. We also offer several key programs designed to support organizations and professionals in their efforts to engage voters. There's the Civic Health Partnership. This program encourages hospitals and associations to become part of the movement that bridges healthcare and democracy. Partners in this program commit to actions like encouraging voter registration among their staff or members using provided templates for communication and promoting Civic Health Month sponsored events. We also have the Community Civic Engagement Grant Program, which is aimed at federally qualified health centers and clients. The initiative provides funding, resources, and training to support nonpartisan voter registration and education for patients. It's part of Vot-ER's broader effort to utilize healthcare settings as trusted spaces for fostering civic participation. And then finally, the Healthy Democracy Campaign. This is a voter registration competition targeted at health professional students. It leverages the enthusiasm and network of students in medical schools and healthcare professional programs to drive voter registration efforts, creating a spirited and impactful way to engage the next generation of health professionals in civic activities. I myself have been able to participate in the the Healthy Democracy Campaign, as well as Professor Kazanov. Not to toot our own horn, but St. Leo, which is my undergrad, we have won the Healthy Democracy Campaign last year, and then we were in the top 3 the year before. So it is a really, really fun way if you work in a school or if you're a student yourself to get people involved on campus, because it does some healthy competition. So definitely want to advocate for that. This happens in the fall, but you can register now. I will provide a QR code at the end to register. And with the election, like the presidential election happening later this year, it's really a great way to get people involved on campus. And last but not least, Vot-ER helps give a sense of belonging and groundedness to participating health professionals. We did a survey of people that use our tools, and 79% said that Vot-ER helped increase their sense of personal agency to affect change. And then 50% said that Vot-ER helped protect them from workplace burnout, which, as we know, self-care is a huge thing in our profession. And not a lot of people think about like civic duty as self-care, but it can definitely be viewed as that. I know, like when I go to the polls or when I see my nieces wearing like future voter stickers, like it really like gives me a sense of like happiness and belonging that is not able to be received in other spaces. So it really is a great way of kind of like boosting your morale and your mood when you do civically participate. And so what are the next steps? You can order your own badge right here, not right here, but on the screen. If you wanted to scan that, I'm going to give you guys 2 minutes. We're going to put 2 minutes on the timer and have you guys see how easy it is to register to get a badge. It's free, and they'll send it directly to wherever you receive mail. And then I'll also drop a link in the chat for the badges. And I don't know if Christina has anything to add. We just recently redone our badges to be a little bit more, to utilize the feedback we received from users about them. But they're really a great tool. Christina said she wore them on campus. I also wear mine on campus. It really sparks a conversation. A really great story I have is I go to Boston University. I did a couple of these talks with a few student classes, and these are actually 2 things. One student came to me after, and he was like, I just registered for like I just registered to vote, and then I voted for the first time because of your talk. I got the registration alert that, you know, like a local voting event was happening, and he went out and he like showed me his sticker and he was very proud. And then also we talk a lot about like healthcare spaces and like doing this as a community, but there's also people that are like lone wolves doing this kind of work. I have a fellow student of mine that like he goes around his neighborhood with the badge and he just asks people in his neighborhood if they're registered to vote, because it's so easy to access, to check your voter registration and then to also be able to register to vote through using these badges. So those are just two instances where in just like the past couple months that people have been coming up to me and saying like, oh, this is what has occurred after using the badges. So it's been really cool. I don't know if Christina has any examples as well.
Yeah, one of the things that Vot-ER supplies you also is digital support in regards to the badge. So if you have a client scan the badge and they're unable to navigate the system, they connect with a 24/7 hotline that will be able to walk that client through the process so that you don't necessarily have to do that. At my university, trying to get a college student to sit down with you to talk to you for a couple of minutes can be really daring. So when they're going to class, we say, hey, are you registered to vote? The number one thing is I'm heading to class. I'm like, great, scan my QR code. And while you're walking to class, you can fill it out and learn about it. So it's really simple for those that are on the move. The other thing is with those digital pieces, you can become really creative. So for example, when Vot-ER sent me my digital package with my own QR code on top of my badge, I was able to take that QR code and put it on numerous flyers that we hang around our campus. So we have them in strategic areas where students are. We have them in strategic break rooms where staff and faculty go, so that even if you can't have that conversation, that flyer sitting out there. So for many of our clinical social workers, they put it in their waiting room because again, many people, that's where they start. Their journey with you is in that waiting room. So having that there next to the HIPAA statement, next to the how do you get out of the building, the emergency part, and it's just having that flyer there with the QR code can be empowerment enough. So Vot-ER gives you really unique ways to be able to incorporate voter registration beyond just the ask.
So I hope you guys were able to go ahead and register to get a badge. There's a pretty quick turnaround time to receive them as well. So once you register to get one, they ship out pretty quickly. And I also wanted to give you guys an opportunity if you are in a school or work in a school to sign up for the HDC. It takes place in the fall, like I said, but you can register now. Again, it is a really great way to bring like the community aspect into the work on campus and kind of remind students of our ethical and professional standards as social workers, and really give them an opportunity to work with large groups of people. Like it's a great way to like start community organizing, like kind of planting those seeds into students, and even like giving clinical students an opportunity to get some policy or macro work under their belt. So yeah, I will give you guys a minute to do that. And then I believe that would be that. Yeah, that's the end of our presentation, but I feel like we're going to have a lot of questions in the chat. So you can start dropping those as well. And we will be happy to answer them.
So Vanessa, one question we did get, and I'm going to paraphrase as I scroll up and try to find the exact question, is how do you really maintain nonpartisanship when you're asking somebody to register to vote when the organization behind it could be considered left-leaning or right?
That's a good question. So I think the funny thing is that voting in general is kind of seen as a partisan issue. So I've had people, when I've asked them to vote, immediately kind of get their fur up and be like, why is this person asking me to register to vote? It's typically in general seen as left leaning. But at the end of the day, if somebody asks, or if somebody seems concerned about that, you can even just say, I'm here to register for you to vote. Doesn't matter who you're going to vote for. I just want to make sure that you are registered and that you have, like, your voice gets heard and that you have the ability to make these kinds of decisions that affect our local government. I mean, it's just as simple as saying something like that. If you worked like with a left or right leaning place, I think that it's definitely like kind of murky. But as long as you like instill in them that you're not trying to say vote for this person, vote for this bill, or anything like that, just encourage to vote locally, to even encourage like, hey, like, go ahead and kind of research these people, and obviously do not mention who you're going to vote for. Just keep those things in mind. And Christina, if you have any insight on that as well. We've talked about it a lot on campus, and yeah, it's definitely an interesting thing to navigate, especially now that there's like so much contention between both sides. But again, at the end of the day, it's about getting people registered to vote and not getting people to register for a political party. Yeah.
What I'll add to that is, when you're asking someone to register to vote, what hat are you wearing that day? So for example, when I'm talking to my family and friends, I'm talking as a family member who's trying to get their family to be a part of it. And I can be as partisan as I want with them. But if I'm doing this as part of my role as my job, there's two things you have to consider. First of all is, are you able to do that? Some, even though it is legal, some 501c3s particularly have strict policies and procedures on how you ask and when you ask. So you definitely want to get their permission and let them be aware that this is what you're doing. And two, and you are wearing your professional hat, it is maybe starting with, I'm going to ask you a question, if it, particularly to voter registration. I'm doing this because A, it's legal for me to allow to. It's very similar to what Vanessa said. You can state the Voter Registration Act and then go into the reasons why you're asking. Because as a therapist who's working with you on your mental health, working with you on your health care, this is tributes to that. And then go into doing the ask. You don't have to misrepresent yourself. You can be very clear. And if they ask you, well, what party should I register for? Who should I vote for? Then you give them the tools of where they can find out that information. They don't have to make a split decision that moment. And you definitely need to set boundaries and tell them that you can't help them with that. That's a personal choice, but here are tools where you can look up the different parties and you can look up the different places. I do want to just kind of go over, I think it was Julia's question. Do you think registering to vote is viewed as a left leaning because there's so much news about the Republicans legislating restrictions to voting rights? In the state of Florida, Republicans actually are out matching Democrats in voter registration. So it is truly not a partisan component depending on the state that you're at. Yes, the media has really played a huge influence on politics policies, but again, voter registration is not necessarily about political components, but having your voice heard in the democratic process. When we talk about the founding of the country and we talk about voting and democracy, people understand that no matter what political side that you live on. So bringing it back to that, upholding our Constitution, upholding our democracy. This is part of democracy. If you're frustrated with how politics are, this is why we live in a democratic country. Being able to have your voice heard, bringing it back to that and getting it out of the politics is really helpful when we talk about that nonpartisan component.
Yes, thank you. All right, now I have a question from Jennifer. Would you encourage people outside the health field, but who are public facing, to request a badge? I would say yes, but with a caveat that like most of Vot-ER's tools are geared toward the healthcare spaces. So if there's like any further support that they need, they might not be able to receive the same as if you were a healthcare institution. But as always, I would encourage people to, if they're public facing, it's just so easy to grab the badge and have the QR code there. So I would say yes, but with that caveat that other resources might not be super applicable to those people. But we have a fellowship that runs every year. We do have non-medical facing people in those fellowships as well. So yes, I would say yes. Okay.
I saw a question about how many social workers are elected to officials, and I really appreciate bringing attention to your PACE chapter. Yes, right now, if they haven't already done so, your local NASW PACE chapter should be coming out with their endorsements of candidates. They definitely do the endorsement of social workers. They will do some other endorsements. So I would definitely check out your PACE committees. But I would also look at CRIS. That is for your congressional representatives. You would think I remember all the acronyms for CRIS, but I'll put it in the chat. It's KRISPS. This will bring you, if you just do a Google of this, it will bring you to the actual social work caucus in our federal government. We do have a series of small but mighty social workers that represent us at the federal level. And there are social workers that represent us both in our state and local governments as well that we want to pay attention to and we want to support. If you are interested in running for elections, then join a campaign school. Many chapters are doing campaign schools. There's wonderful organizations out there, because who's better to make decisions than social workers? We have a good temperament of what's happening on the ground. We can make complex decisions, and we do it in a way of self-actualization. It's not about us, it's about who we serve. And isn't that the right person to be an elected official? So definitely consider running for office too.
Yeah, that's something that just myself knowing how surprised I was that social workers had such a place when I first took my policy class, that we have such a place in government. I think since learning that, I'm just like, we need so many more social workers in the government space. Silas, how are we on time?
Oh, we can take a few more questions.
Okay, cool. I did see someone mention that to make sure that you're aware of state's laws regarding felons and unhoused individuals. That is a really good point. In Florida, we not just recently, but like about 4 or 5 years ago, we passed to reinstate, to be able to reinstate people who have previously been incarcerated to be able to vote again. There's a lot of caveats now put into that, but it is always good to be aware of what your state laws are, just in case you need to have other resources for that. And then again, unhoused individuals, to look into that as well.
Brenda, I saw your question. What's the earliest Americans can register and actually vote? Is that age different? The age for registration is going to be different state to state. So for example, in my state, we can pre-register as early as 16, but federal law says you have to be 18 years old to actually vote. So to register, I would go back to your individual state law to see what is the earliest that you can do that.
Yeah. Michigan is a state that has made it much easier and accessible to vote. Yeah, we love Michigan at Vot-ER. You guys are always doing great stuff. And sorry, you guys are, I love how chatty this this chat has been. You guys have been very vocal, and I really appreciate that. As a host, sometimes when it's silent, it's very hard to think of things to talk about.
Julia, we need more positive news about voting rights in Florida. Yeah. When I tell people I'm from Florida, that's why I say yes, I'm from Florida. But let me rest assure you, there are good people down here like myself, my colleagues, my students that are trying to do the good work. We may not get the publicity behind it, but here's the thing. This work is not about the publicity. It's having those one-on-one conversations and trying to inspire other people. And I can guarantee you, Julia, there are plenty down here in Florida that are doing that good work. And just getting people's voices to be heard.
Yes. I think that's all the questions that were in the chat. I'm going to put my email in the chat if that's okay. If you guys want to reach out, and Christina, you can put yours as well.
Thank you, Julie.
If you guys want to reach out, I'm always available to have a chat. Or if I don't know, I can definitely find the answer to anything that you guys need. Yeah, and I think someone was having trouble registering to get their badge. I think it was
Alina's.
Yeah, if you just want to email me, I can help you if you need some help. And we'll pass it back.
Vanessa, there's just one other question that I think we missed. So it says, I've never heard of any type of legal ramifications of a social worker asking their clients if they want assistance to register to vote. Can you share some examples of when, where, how it may be illegal for a social worker to ask clients if they wanting assistance for registering?
I think I honestly don't know. So I might need to get back to you on that. I haven't ran into any situations like that. I think where it starts to get like murky is like if you're completing the thing for them without their input or things like that. I think the important thing about Vote-ER is that they're doing it for themselves, that they're registering themselves. If they need some help answering questions, that's fine. But I don't want to give an answer that's incorrect. So whoever asked that question, please email me. I will get you a better answer. I just don't have the depth of knowledge on that, unless Christina, you do.
So Rebecca, the only thing I'm going to add is, again, it's going to be dependent on your state laws. And then also, what is your organization that you're working for? What is their title? If they're a 501c3, a 501c4, whatever that is. So there's two things that you have to follow. So for example, if Vote-ER is electronic voter registration, some states allow that, some states don't allow that. So you want to make sure that you're following that component. What's great about that Vote-ER, even if you're not 100% sure what your laws are, if you scan the QR code and it says that it's not allowed, it will automatically tell you contact your supervisory elections. You'll know voter registration online is not going to be applicable for you. However, there are some states that allow it, but are making paper voter registration much harder to do. So you really have to look at if you're going to register as a third-party registrant, what the laws are for that. But if you're doing it as an individual person, not as an organization, there really aren't any legalities out from it as long as you're staying nonpartisan. The minute you choose to talk about a campaign, a party, then it's against the law. But if you're doing it as an individual person and you're just asking voter registration and you're telling them that they need to make those choices, you should be in the clear. So look at your state laws and look at what your organization, if you're going to do it as an organization, what those laws say. And then if you need to register as a third-party registrant with your state.
Yeah, I would also add, just since someone asked about working with people with felonies. There's certain states have certain laws, depending on your state, such as Kentucky had a law that they passed in the past couple of years where someone with a felony that hasn't been reinstated, if they try to register to vote, it is a crime. So I would say just, also research into that. And then overall, just thank you, Vanessa and Christina, for such a great presentation. Just a few little things. Our next webinar series, or episode in the webinar series is on September 13th, same time, on a Friday. It's around policy and advocacy priorities, mainly in Michigan. And then Vote-ER will also be joining us again on October 17th for LEAD, where we'll take another step in this conversation about how to really have these tough conversations around voting. And the people asking for CEU certificates, yes, you'll be sent them with follow-up email with the slides when we get them. And also for our NASW Michigan people, there is next Thursday, this upcoming Thursday, our MPACE meeting at 12 if you are interested. Other than that, I hope you all have a great Friday.